Welcome to The Explainer. Today, we are going to break down a condition that is way more common than you'd think, and it often flies completely under the radar until it becomes a really serious problem. We're talking about deep vein thrombosis.
So, let's just jump right in with a question for you. When you think about the biggest, deadliest cardiovascular issues, what comes to mind? Probably heart attacks, right? And strokes, for sure. But what's number 3? I'll give you a hint. It's often called a silent killer.
And the answer is deep vein thrombosis, or DVT for short. Honestly, the best way to picture what a DVT is to think of a massive traffic jam, but inside your veins. You've got this major highway for your blood, and suddenly there's a total blockage. And just like on a real highway, that kind of jam can cause some huge problems down the line.
And you know, this isn't some super rare, bizarre medical condition. In the United States alone, we're talking about over 200,000 people developing a DVT every single year. To give you a sense of that number, that's enough people to pack a giant football stadium. So yeah, this is a major public health issue.
Okay, so a traffic jam in your veins. Sounds bad, but what makes this particular blockage so incredibly dangerous? Because the problem isn't just about some pain or swelling in your leg. The real threat is what can happen next.
A DVT really has two major dangers. The first one, the most immediate, life-threatening one, is something called a pulmonary embolism, or PE. You can think of a piece of that clot breaking off like a rogue torpedo shooting through your bloodstream. If that torpedo hits your lungs, it blocks blood flow, and that is an absolute medical emergency. And even for people who survive, the story isn't over. A huge chunk of them can develop a long-term condition called post-thrombotic syndrome, which means dealing with chronic pain, swelling, and skin problems that can seriously wreck their quality of life.
So how do these dangerous clots even form? And who should be most worried about them? Well, it turns out there's a classic framework that doctors have been using for a long time to figure this out.
It's called the Virchow triad, and it's basically the recipe for making a blood clot. You really just need one of these 3 ingredients. First, some kind of damage to the vein itself, maybe from a surgery or a bad injury. Second, something called stasis, which is just a fancy word for blood flow slowing way down or even stopping, like when you're stuck on a long flight or on bed rest. And third, hypercoagulatability, which means your blood is just naturally stickier or more likely to clot than the average person's.
So how do those 3 things, vein damage, slow blood flow, and clot-prone blood, actually show up in real life? Well, they're often kicked off by pretty common situations. Being immobile for a long time, that creates that slow blood flow. Major life events like surgery or even pregnancy can cause both vein damage and slow flow. And then there are underlying medical conditions, from cancer to obesity, plus lifestyle choices that can make your blood much more likely to clot.
And here's the thing, it's not always about something you did or something that happened to you. Some people are just born with a higher genetic risk. You can have inherited conditions, like something called the factor V Leiden mutation, that make you more likely to form clots your entire life. And you might have no idea, not until the clot actually happens.
Okay, so if a DVT can be totally silent, and the risk factors are all over the place, how in the world do doctors actually investigate and find this hidden threat?
This is where it gets really tricky. You'd think there would be clear warning signs, right? But the reality is completely different. Yeah, about half of patients get pain, and a lot of them have swelling, but, and this is wild, up to 50% of people with a fresh DVT have no specific symptoms at all. It can be completely and utterly silent.
And this quote from our source material just nails the central challenge for doctors. It says that trying to diagnose a DVT based on symptoms alone is notoriously inaccurate. You just can't do it. You can't just look at someone's leg and know for sure.
So because of that, they use a very structured step-by-step process. It usually starts by just sizing up the patient's risk using a scoring system. Then there's a blood test called a D-dimer that's really good at ruling out a clot if it comes back negative. But the gold standard, the test that gives the final definitive yes or no answer, is a leg vein ultrasound. That's what lets doctors actually see the traffic jam inside the vein.
Okay, so the ultrasound confirms it. There is a clot. What now? Well, the focus immediately pivots to resolving the situation safely and, most importantly, preventing those really dangerous complications we talked about.
The whole game plan for treatment really boils down to 2 incredibly simple but absolutely critical goals. Number 1, stop that clot from getting any bigger. And number 2, and this is the big one, prevent any little piece of it from breaking off, traveling to the lungs, and causing a pulmonary embolism. That's it.
Now, to hit those 2 goals, doctors have a few different tools. The main one, the cornerstone, is anticoagulants. You probably know them as blood thinners. Now here's a key thing to understand. They don't actually bust up the clot that's already there. What they do is prevent it from growing, which gives your own body time to break it down. For really severe cases, they might use actual clot-busting drugs. And if someone can't take blood thinners for some reason, a tiny little filter can be placed in a major vein to physically catch any clots before they can reach the lungs.
So, we've talked about finding it and treating it. But of course, the best possible approach is to stop a DVT from ever happening in the first place. So knowing everything we now know about the causes and risks, what can we actually do to protect ourselves?
The good news is you have way more control here than you might think. Simple little actions can make a massive difference. The absolute most important one is just to keep moving to prevent that blood from getting stagnant. Get up, walk around on a long trip, move as soon as you can after surgery. Staying hydrated helps, quitting smoking definitely helps, and wearing compression stockings can be a great tool too. And finally, just knowing your own personal risk factors and talking about them with your doctor is so important.
So we're going to leave you with this question. Because now that you know all this, what's one small thing you can change? Whether it's just doing some ankle pumps on your next flight, taking a walking break on a long drive, or just having that conversation with your doctor. Understanding this silent threat is truly the first and the most powerful step you can take to prevent it.